Africa.
Well, the time is just gone 5:28 p.m. as we head towards the time of iftar, which is at around 6 p.m. in Johannesburg, and still to come. It's the humanitarian segment, which we normally do at this time, recognizing the many organizations, individuals who do wonderful humanitarian work, and also showcasing them, and also expressing our thanks and appreciation to these wonderful people within these organizations that make a huge difference in the lives of people. And we also have got the Nasiha that will come through at around 10 minutes to 6, which is going to be the build up to iftar and the dua, and the adhan at around 6 p.m. that will signal the end of day 18 of this month of Ramadan. But right now, it is a humanitarian segment, and we're going across now to be joined by the Islamic Medical Association of South Africa, the Western Cape region. We are talking with Dr. Riaz Ismail. Doc, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome, and we trust and hope that you are having a wonderful Ramadan, inshallah.
Wa alaikum salam. Shukr. Yes, we are having a wonderful Ramadan in Cape Town, and thank you very much for having us on your show. Thank you.
Yes, Doc, talking of the Islamic Medical Association of South Africa now, we've had a lot of interaction with the organization on a national level in the past as well, but particularly looking at yourselves in the Western Cape, and each province unique in a sense that each one has got its own requirements, its own challenges as well, and also in terms of effort in terms of humanitarian projects as well. Each one is unique. So just before we get to your specific projects, just an overview on the Islamic Medical Association of South Africa, the Western Cape region in particular.
So the Islamic Medical Association is a body formed 40 years ago, over 40 years ago, started in Durban, spread out throughout the whole of South Africa. We now have branches in Cape Town, Durban, Klerksdorp, Johannesburg, Port Elizabeth, and members throughout the country, but the main branches being in those regions. Our main effort is to try and present medical services to those that are not able to get medical services, and in different forms. We were very active during COVID with oxygen concentrators, with home visits, with telemedicine consultations. That was one of the things that really brought us to bear, because we had to change the focus of how we work. In KwaZulu-Natal, we have clinics, fixed clinics. We service up to 100,000 patients per year in those clinics. We also offer dialysis throughout the country in a specific manner. Where patients are not able to afford dialysis themselves, we pay for dialysis for a year until they can get a medical aid, which is then active, and the medical aid will then take over their dialysis going forward. This does present a large problem, because many people require dialysis, and the state cannot always afford to provide for everybody. So many people are turned away at the doors of the state hospitals. In particular, in the Western Cape, we work with Groote Schuur and Tygerberg Hospital in particular, and where the academic sector have got a patient who will either get onto their dialysis program or is just borderline, we offer the dialysis service. There are many other patients as well that will not normally get dialysis, that will be able to access it in private through a medical aid. We fund that for a year. Many of our regions do screening programs, particularly aimed at the elderly in areas where there are many of the needy. And we go in once a month at the moment in Cape Town to various areas where we will do blood pressures, we will do sugar checks, we will check the ears, we will check the eyes. We have a physiotherapist that comes along to help and assist us. We use this as a teaching opportunity for students, both in the medical, nursing, paramedic, pharmaceutical studies, and they are able to then assist us and also learn from the patients in various ways. There's nothing like having a lady or a gentleman sit across the table to you and explain to you the real problems in trying to go through a packet of 12 different types of tablets when they don't understand half of what they're getting. So that helps the students also to bring it down from a very high academic level to the level of somebody who can understand it across the table from them. Our main focus for Ramadan at this point is our fund collection towards our dialysis program. And to give you an idea of the cost, it's about 9,000 Rand for us, for the IMA. It's a lot more expensive in private, but 9,000 Rand at the subsidized rate for the IMA per month per patient. And that works out to 108,000 Rand per year. What we are appealing for is anyone to consider any amount that they can give, whether it be 50 Rand or 100 Rand, but make it a recurring deposit monthly, please. And all the little bits together will add up, and that will be what we can use towards dialyzing a patient. And every little bit of sadaqah, lillah, or any amount that you want to give in any way, your your zakah, sadaqah, or lillah is all accepted, and you just have to denote in your description that it is whichever of those categories. We will then disperse accordingly for the dialysis. The important thing for us is to try and get to as many people as possible. And the main limiting factor for us is the fact that the access to funds. So if we can access a regular stream of money, we are able to accept somebody for even a short period. And often we get that call in the week. Somebody, 30-year-old husband, mother, father of children, mother of children, requires urgent dialysis. Can you assist for 2 months? Now, 2 months is 18,000 Rand. If we do say yes, and we often say, we more than likely will say yes, that money comes away from someone else. So then we have to continue to find money. And alhamdulillah, Allah is Qadir, everything gets taken care of. But our appeal is that if anybody is able to give us the price of a burger meal, 100 Rand a month, regularly every month donated into our account. You control the on your side. You set up the debit order on your side. There's no cost to us. There's minimal cost to yourself. All the money goes to dialysis. Of the money that you're donating, none of it will go to administration of the whole project.
Well, Doc, I'm just looking at it, and I've seen that 200 Rand that will buy a person, 20 minutes or so on a
Yes.
dialysis as well. I was just reading, and like you mentioned, is the price of a burger meal. And sometimes, we would go and eat out every second week, but at the end of the day, just sacrificing one meal to make a difference. But also, Doc, coming back to the Islamic Medical Association, Alhamdulillah, we've seen the dedication, not only at a local level, and we want to still talk a bit about the in the poverty-stricken areas, in areas like Langa, for instance,
Yes.
in your part of the world, and I'm sure that there are many other areas like Langa around the country where IMA has got its presence. But it's assisting people, but also coming from an organization like the Islamic Medical Association, Dawa as well. It actually, there are so many benefits to the type of assistance that you are rendering apart from just medical assistance or medical help, Doc.
So, what in Langa in particular, the Langa Masjid, we have partnered with the people running the Langa Masjid, and what we do is provide a clinic on a Saturday morning, primary healthcare clinic run by medical staff, so a GP, students. There'll be a nurse. We're also trying to expand it to pharmacy students and others. And we provide that service on a Saturday morning. Going forward, funds dependent, we want to employ a nurse to run a screening program for the entire week. So Monday to Thursday, we'll have a clinic running where we will be able to do, on, say, for example, a Monday, breast screening. On a Tuesday, we will screen for prostate. On a Wednesday, and as we go along. There's also, as you can well imagine, there are clinics, there are healthcare services within the Western Cape, but they're overrun. There are many people who are not getting the kind of service where you can just sit down and have a 10-minute conversation with the patient and work out what exactly is required. Just by virtue of the exposure to the masjid, just by virtue of the exposure to the healthcare professionals who come, that in itself is a big dawah. And we've had many people who over the years have either accepted Islam or have had a totally different viewpoint of Islam because of the exposure that they've had to us in Langa. We open our our teaching program to any student. We don't draw the line at whether you're Muslim or any student who would like to assist and who would like the teaching. We provide that to them at the Langa Clinic as well. That coupled to the masjid, who often runs feeding schemes or feeding programs and dawah programs, that works so well together, where people come and they experience not just healthcare but also Islam.
Yes, and Doc, also, we sometimes don't give credit to, where it is due, and we don't give credit to individuals who put in a lot of time, who put in a lot of effort, who make a lot of these sacrifices as well. And that goes with the medical fraternity here in South Africa, the Muslim medical fraternity. You mentioned earlier on, you spoke about the time of COVID, and we know that there are many that give a free service in more ways than one, not only locally, but even if there are disasters in other parts around the world, the presence of the IMA is always there. And we need to recognize that, we need to acknowledge that, and we need to also give credit to all these individuals that who sacrifice so much for the benefit of humanity and mankind at large.
We're just grateful for the fact that we've been given the ability to give back to people. One of the founding fathers of the IMA said that, how do I pay my zakah on the amanat that I've been given? And we don't heal, we heal, we are just but vessels and vehicles for Allah to heal people. And the amanat that we have to be grateful for. And the only way that we can pay our zakah on that amanat without just paying money is by paying our time. And you're right, throughout South Africa, there are many healthcare professionals from all walks of life, from all disciplines, who give their time and give it selflessly. And for example, the Turkey earthquake that happened, that was the most recent international disaster. The IMA will supply funds by collecting within their members and with everybody who subscribe to them, but also where possible, we will partner with organizations like Gift of the Givers, and we will send healthcare professionals to the various places. Many of our members have accompanied various organizations internationally in providing relief and trying to assist wherever they can, not only on a national but also on an international level. One of the other aspects that we do is we also are trying to provide wherever possible, either whether we are asked to or not asked to, provide benefit by giving, I wouldn't call it dawah, fatwas, but by assisting with the medical knowledge to enable the shuyukh and the different religious bodies to make an informed decision on whatever whatever crisis we're facing. For example, the whole issue about vaccination in COVID. Yes, no, what are the benefits, what are not the benefits? But never mind just that, how to manage the masjids in COVID in terms of spacing. Is it allowed, not allowed? The allowed, not allowed, that part we leave to the ulama. But the medical reasons for it, that part we could give them. So there's many other aspects that we are getting involved in, where we're trying our best to try and deliver a collective service to everybody in South Africa.
Well, I quite like that, what you just said, Dr. Riaz, about the shuyukh and about the ulama, and providing them with the guidance, because we know that sometimes these are highly controversial issues, but the ulama also need to be guided by the experts, by those who Allah subhanahu wa ta'ala has blessed with the necessary knowledge, so that they can issue the necessary, make the necessary decisions, they can issue the necessary fatwas, and all of it at the end of the day for the benefit of the ummah at large. But Doc, just looking at contributions, now I see there was a banner that was up that gave the banking details and the contact details as well. And I see on the screen it says contact IMASA Western Cape on WhatsApp 021-762-1414. I'm not too sure if that is a WhatsApp line.
That is a WhatsApp number. Yes. It is a WhatsApp number. Yes.
Okay.
So if you missed the appeal or missed the details on what you've seen, if you can WhatsApp that number, our secretary will then provide you with a leaflet, and that leaflet will give you all the details of our banking details. And then just please make sure that you put your reference The reference would be for dialysis. And then if you want to just put a hashtag zakah, if it's zakah, sadaqah and lillah we'll take care of, but specifically zakah, obviously there are rules associated that we have to then ensure those funds are dispersed in the correct manner.
Well, Jazakallah for that. And I'm just going to read out the information or that's come up on screen, the banking details for the Islamic Medical Association of South Africa, IMASA, Western Cape, Eastwood Standard Bank, and the account number 072912685, 072912685, the branch code 026209. And if it's for dialysis, yes, just put down the reference as dialysis as well. And they've got their WhatsApp number 0217621414, or you can go onto their website, www.imasa.co.za. Dr. Riaz, Jazakallah khairan so much for that and for your time with us this afternoon here on Salam Media, alhamdulillah, as part of the humanitarian segment and highlighting the Islamic Medical Association of South Africa, the Western Cape region as well. Allah accept all your efforts, Allah reward all your efforts as well, and Allah grant you success, inshallah, as the organization for the benefit and the well-being of mankind at large.
Inshallah. Shukr, and thank you very much for having us on your show. And we make dua for whatever you've asked for us. We ask for the same for you and your show and all the listeners.
Ameen, ameen. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalam wa rahmatullahi wa barakatuh.
Dr. Riaz Ismail was us, Islamic Medical Association of South Africa, Western Cape, and that was part of our humanitarian segment, which brings us straight on to 5:45 p.m. And we are heading towards iftar, or the time of iftar, very, very quick. In fact, in about 15 minutes' time, the azan will be given for the signaling the end of Ramadan, day 18 in Johannesburg. We know Durban, they've already having the iftar as we speak right now, but we've still got the nasiha and the dua coming through on the program, and that will be in at about 5 minutes from now. So we're going to go for an ad break, and when we come back, we'll be joined by Maulana Abdul Rahim Blessing from the Kwa Mashlanga Muslim Jamaat, who will provide us with the nasiha and the dua in the build-up to the time of iftar.